Good afternoon, Chairman Wenstrup, Ranking Member Ruiz, and members of the subcommittee. Thank you for ensuring that we identify and implement lessons from the COVID-19 pandemic to enhance our public health preparedness and our national security. My office leads U.S. engagement with WHO and has been working since the start of the pandemic on institutional reforms that improve transparency and accountability, both within the organization and, as you said, sir, across its 194 member states. We work closely with our colleagues at the Department of State and USAID, as well as other federal agencies, to build pandemic prevention, preparedness, and response capacities worldwide. Of course, the world has been profoundly impacted by the COVID-19 pandemic. In the U.S., unfortunately, we tragically lost more than 1 million lives, and nearly 7 million have died globally. We know there's no ocean large enough to protect Americans from a virus that can spread rapidly across the globe. So we also know that it's only a matter of time before the world faces another serious public health threat. As it turns out, WHO has been on the front lines of nearly every global health challenge over the past 75 years, combating, containing, and curing some of the planet's most deadly diseases. Currently, WHO is responding to dozens of serious health emergencies, including in Gaza and in Ukraine. But it takes an effective WHO to adequately guard global health and well-being, supporting the safety and sovereignty of America. Frankly, if WHO didn't exist, we would have to create it. That said, the COVID-19 pandemic also revealed major gaps in our global health security architecture, including, and importantly, at WHO. Working with like-minded member states, the U.S. is leveraging our seat at the table to drive dialogues and solutions required today, because unfortunately, we've learned the hard way that this is in our national interest. So at that table, HHS is leading efforts to update the international health regulations to make them clearer, more precise, and better fit for purpose. Among other important reforms, we're advocating for amendments that would ensure rapid and transparent information sharing, enhance WHO's ability to assess health threats, and improve global implementation and compliance. Additionally, we are actively working alongside State Department colleagues to negotiate a global agreement that seeks to improve international accountability and collaboration on pandemic preparedness and response. Through both of these negotiations, we're advancing long-standing U.S. priorities to reinforce regional capacity and reduce risks posed by emerging infections. Ultimately, we're focused on finding sustainable solutions that break the cycle of pandemic, crisis, and complacency. The U.S. is also pushing for reforms within WHO itself. With vocal U.S. leadership, the 2023 Executive Board meeting and World Health Assembly approved a set of recommendations and plans for more stringent oversight of WHO's budget and business functions. We are closely monitoring progress with WHO leadership and ensuring principles of good governance at all levels of the organization. In closing, I'd like to highlight two of the greatest health achievements of the 20th and 21st centuries: the elimination of smallpox and significant progress in eradicating polio. Both are the direct results of a partnership between the U.S., non-governmental organizations, countries around the world, and WHO. In fact, the U.S. was one of 59 countries that first signed the treaty establishing a World Health Organization. Since then, we've been party to many of its successes and at the same time have pushed the organization to be better over these last 75 years. You can be assured that the Biden-Harris administration is committed to building on this legacy through our ongoing work in service to the American people, which is our North Star. Thank you again for the opportunity to testify on these important issues.
Thank you. Thank you. I now recognize Ambassador Nkengasong to give an opening statement. Good afternoon, Chairman Winthrop, Ranking Member Ruiz, and members of the subcommittee. It is an honor to be with you today on behalf of the Department of State to discuss the U.S. government's commitment to strengthen global health security to protect the American people. We engage internationally at all levels, bilaterally, regionally, and multilaterally, with international organizations like the World Health Organization's WHO. I come before you today representing the State Department's newest bureau, the Bureau of Global Health Security and Diplomacy, which was launched on August the 1st of this year by Secretary Blinken. I would like to thank members of the Congress for their support to establishing this bureau. The COVID-19 pandemic left a deep, lasting impact on all of us, with over 1 million American lives lost and at least 7 million globally. One estimate found that the American economy lost more than $14 trillion due to the pandemic, and economists estimate that global GDP contracted by 3 percentage points in 2020. The last few years have reinforced that a pandemic is not only a health crisis, it's an economic crisis, and it's a national security crisis. Without the combined leadership of the United States, multilateral partners, including WHO and others, the world may not yet have successfully made it out of the acute phase of the COVID-19 pandemic. The coordinated global efforts required to deploy COVID-19 vaccines around the world was a major demonstration of this lesson. A coalition of countries, including the United States, came together with the WHO to support the COVID-19 vaccines Global Access Initiative, commonly called COVAX. The United States, in partnership with COVAX and bilaterally, has donated close to 7 million safe and effective vaccines to over 117 countries and economies around the world, whilst simultaneously investing in regional vaccine manufacturing, supporting healthcare workers, and strengthening our capacity to prevent, detect, and respond to COVID-19 and future global health threats. Under Secretary Blinken's leadership, the State Department continues to play a critical role in elevating global health security as a major priority in high-level global and regional dialogues. Our team at the Bureau of Global Health Security and Diplomacy is focused on collaborating across the U.S. interagency community and with Congress to do all that we can to mitigate future threats. Unfortunately, it is not a question of if a new health threat will emerge, it's a matter of when. The world needs greater cooperation, coordination, collaboration, and communication. A major priority continues to be ending the HIV/AIDS as a public health threat by 2030. And in that spirit, I look forward to working with you in continued strong bipartisan fashion to pass a clean 5 years PEPFAR reauthorization. Despite the challenges WHO has faced, it continues to play a critical role in advancing global health security priorities by its coordinating roles and responding to emergencies and in promoting healthy lives worldwide. The WHO's leadership in developing evidence-based guidelines and policies for combating HIV/AIDS have been critical for enhancing our own diplomatic efforts when working with partners and countries to advance their respective HIV/AIDS responses. The United States must continue to play a critical leadership role to ensure the WHO is reformed to effectively address current and future global health challenges. We have engaged with the task force involved in these efforts and will continue to exercise our leadership in this space. Thank you, Chairman Winthrop and the Ranking Member Ruiz, for the opportunity to testify on this important topic, and I look forward to your questions.
Thank you, Ambassador. I now recognize Dr. Gawande to give an opening statement.
Chairman Wenstrup, Ranking Member Ruiz, Dr. Ruiz, we're across a different table today, and who knew we would be here from where we were a few years ago. Also, members of the Select Subcommittee, thank you all for the chance to speak about USAID's commitment to global health security, to our partnership with the World Health Organization, and the importance of continuing reform to the systems required to secure our collective protection from international health threats. USAID's health investments focus on reducing the global burden of mortality and disease and on protecting Americans from health threats from abroad. We work daily to prevent and respond to emerging threats while also pursuing long-term goals such as eradicating polio and ending the public health threats of HIV, malaria, and tuberculosis by 2030. Success requires global collaboration. Collaboration for impact on health is what WHO has done for 75 years, and that's why WHO has been an essential partner and recipient of USAID funding. WHO's leadership of the Global Polio Eradication Initiative is one excellent example. WHO demonstrates its unique convening power and technical capacity in leading polio activities worldwide. USAID has supported WHO's polio eradication efforts for 35 years, and now we have only 12 wild-type cases documented worldwide in the last year in a small region along the Afghanistan-Pakistan border. And last week, WHO's quiet but persistent diplomacy persuaded the Taliban to finally allow house-to-house vaccination, reversing its long opposition. Among USAID's top priorities is strengthening global health security, the capacity to prevent, detect, and respond to infectious threats that can spread worldwide. And our partnership with WHO is critical in this work, allowing us to leverage its global network and technical expertise to help countries everywhere prepare for and manage dangerous outbreaks. For example, in February, an outbreak of Marburg virus, a deadly cousin of Ebola, occurred in Central Africa and Equatorial Guinea. USAID and CDC supported and worked closely with WHO to respond because of their particular relationships and technical capacity there. Equatorial Guinea had resisted, as often happens with countries, resisted sharing information or permitting foreign involvement in what was happening. But WHO persuaded the government to accept U.S. support that ended up delivering capacity, diagnostic capacity, proper screening, isolation, and emergency treatment procedures, and PPE from the joint USAID-WHO emergency stockpile for frontline workers. And that produced a turnaround that ended the outbreak before it spread anywhere else. There is simply no entity in global health other than WHO that has an equivalent mandate, reach, or capacity to influence the countries where USAID works and where we don't. And that influence is not, however, foolproof. It is up to countries whether they adhere to WHO recommendations, but as we saw during the COVID-19 pandemic, WHO's role is vital. Their systems for safety review, for sharing technical information, for emergency response, made vaccines, tests, and treatments available globally, saving millions of lives. The pandemic exposed some fractures in our global health security systems, including at WHO. With our interagency partners, USAID has pushed for the critical reforms that WHO needed to increase effectiveness, transparency, and accountability in future emergencies and in tackling other health goals. And we see progress in what matters, which is lives saved. For example, historically, Ebola outbreaks have killed thousands, but in the 6 outbreaks of Ebola and Marburg virus that have occurred since I've started, I've seen the response get faster and better. I was especially concerned about an April 2022 Ebola outbreak in a city of 1 million people in the Democratic Republic of Congo. In 2018, a similar outbreak in that region killed more than 2,000 people and required a 2-year, billion-dollar global effort to stop it from getting across the world. Since then, USAID, CDC, and WHO came together with others to help the country improve its response capacity. So in 2022, when a man with a high fever arrived in a clinic in Equator Province and died that day, the health worker had the training to recognize this could be Ebola. He had the protective gear he needed. He had the test equipment to make the diagnosis. He alerted contacts and the national health authorities, who got a team on site within 48 hours. They identified the contacts and brought newly approved vaccines. And as a result, Ebola claimed just 5 lives compared to the 2,000 lost in 2018. WHO and U.S. investment meant that the outbreak required no emergency foreign assistance at all. I thank the subcommittee, and I look forward to your questions.